your life.
I think Dr. Show has disappeared from. Hello, hello. I think we've got a few more people coming here. Good stuff. So I guess we should kind of start going. So it's nice to see you all here today. So I'm Dr. I'm a GP. I actually work in Manchester. And yeah, I've got Dr. Sina here as well. So we're really excited to be here with you today, talking all things Black men's health. And we're really here to kind of share really important issues that can affect us, and also to answer any questions that you all have as well. So I'll let Dr. Sinner introduce himself as well, 'cause I don't want to take all the limelight.
All right, good evening, everyone. My name is Dr. Shina from Nigeria. Some of you might know me as the bearded Dr. Shina on social media. I am a physician in internal medicine in Nigeria. I work at a federal facility, and I'm also a co-founder of a men's health startup here in Nigeria. And I use my platform to make health content, and I'm also passionate about men's health, which we are going to be talking about today. Thank you so much.
And yeah, so I think we both share that passion really for men's health, and I think it's all about communication. So in my busy GP practice where I work, there is always a need to bring forth really important issues. So this whole month we've been really championing Black men's health, and specifically seeing how we could help our demographic, and really answer any kind of questions. So I think what we're gonna go through are, I guess some of the most common issues that face our population, and then take it from there, really. So I think I guess Dr. Sin, you've done quite a lot of work on kind of cardiovascular disease and things. I think you've done quite a few posts stuff. So I'll be interested in hearing a bit more about your thoughts and kind of how that impacts our population and things.
Okay, thank you very much for that. You'd agree with me that cardiovascular diseases are a big one, and when it comes to Black people, we are at a high risk of cardiovascular diseases, and the spectrum from heart attacks, to stroke itself, hypertension, a big one, and other non-communicable diseases. And one thing I think in particular is that for us Blacks, let me use Africa as an example. I think one of the things that has really, really, really increased the risk of all of this is one, our diet. One, I think it's a huge one because, I would not want to say that, the level of poverty in a third world country, let me use an example, Nigeria, where I am, inflation is pretty much on the high side. So you don't have people eating healthily. So people don't have great diet and all of that. And that also, it can increase their risk. And one thing also with us here is like we take a lot of salt. For example, in the past few months, a lot of organizations have been doing a lot of campaign against excessive intake of salt because we know that excess intake of salt increases the risk of hypertension, heart diseases, strokes, and all of that. Next, also, I think alcohol intake has really contributed to a lot of cardiovascular diseases. And I'll say Nigeria is like the alcohol capital of Africa because we
Really?
drink, we do a lot of partying, we do a lot of that. We take a lot of alcohol, and apart from the high-end big alcohol, the thing is that we also have this sachet alcohol. So for as low as, well, I don't know the equivalent in dollars, but for as low as 100 naira, I don't know how many cents that would be. For as low as 100 naira, you can actually get just small sachets of alcohol, and you have people
Yeah.
been drinking up to the point and all that. Cigarette smoking also, well, that's also a big one. And let's now talk about more about things like sedentary lifestyle. A lot of
Exactly.
people
Yeah.
are not saying, there's this thing with big manism where in us we just believe that if you're rich, well, I just have to be chauffeured to work. I have a driver, I don't have to walk around, I have my maids doing everything. But we know that all of this lifestyle actually increases the risk of one having cardiovascular diseases. Obesity is increasing. We're having more people because of sedentary lifestyle, unhealthy diets, and all that other factors are having more of obesity too. I think is
Yeah.
also contributing to that. And another thing again is that a lot of time, many of these people come with complications because they don't really come to a hospital. Poverty also, because when you're poor, the chances of you going to a hospital are slim because there's no money for consultation.
Yeah.
And in a country like African countries where we don't have health insurance, most people pay out of pocket. It's pretty much expensive, and a lot of people rather not. So I think that, and if you see with all of this, we're having more increases of things like heart attacks, strokes, and things that even kidney damages. We're having more of chronic kidney diseases, which can also be as a result of this cardiovascular event. And we're having it's all increasing, and we've been doing a lot of campaign awareness because we want people to understand that all of these are unhealthy. So I think, well, that'll be an overview
It's
for cardiovascular
multifactorial,
health.
isn't it? There's so many
Exactly,
things.
multifactorial.
And
Yeah, family history also increases the risk. Also, for example, a family member had a stroke or have had a heart attack and all of that. We also know that that also, contributes to the incidence of many of these cardiovascular events. Thank you.
yeah, what I say, so I've got a YouTube platform, so I create patient information videos for my patients. And in my practice, we've got quite a big population of patients that are from African countries and things. So, and one of the things that I actually reflected on, I created a video on why the benefits of a traditional African diet, and all of the things that you touched upon, such as kind of lack of activity. So, and also using more processed foods, which is what's happening now. So people are eating more processed foods. And the problem with that, like with McDonald's, KFC, not only are those meals not healthy for you, but also they've got very high salt content as well. So there are loads of things that have changed in terms of how we are living our lives right now that maybe our ancestors didn't really live. Our ancestors were, a bit more active in kind of getting the food and doing a few more things. So it touches upon. So there's so many factors. And I really like the point you made about access as well. Having the access to actually see a health professional, because that works in two ways. It could either be like your point you made, some people might not be able to afford in certain countries to see a doctor, but also it could also be that some people there might be a barrier that they might not feel comfortable enough or able enough to go and see their doctor due to loads of factors. And when that happens, that's when we see lots of delayed presentations and things. So I guess one of the questions and thoughts I had is how would we look into the access thing, and how was one of the ways that we can try and engage more people to actually go, if you're able to go and see your doctor or speak to a health professional if you're worried about your smoking, your salt intake, your alcohol intake. What are some of the ways? And I guess that's why we're here today.
Yes. Okay. So, well, I think the first thing is we need awareness
Yeah.
because ignorance is well, it's not an excuse, but it's a big killer. A lot of people don't understand it, and I'm happy we're having this heal sessions. I'm sure we're going to have more of this where we're going to talk about this because the first thing is we need awareness. We need to talk more about it. We need to talk to people more about how the dietary choices, the lifestyles, and all of that translate to their health as a whole. Because if people know more about this, I'm sure that they're going to embrace healthier lifestyle, which is going to reduce the risk of a lot of this cardiovascular. And I think another thing is, well, people need to, we also, part of the awareness is we need to also talk about healthy diet.
Yeah.
For example, let me use an African diet as an example. The classical African diet is a big, huge chunk of carbohydrates. Then you have this like tiny protein and little veggies. That's usually the classical picture. So we need to have all of that. We need to take people portioning by using pictures, by using videos because for example now, if you have an African family, I like to use Africa because I because I'm African and
Of course.
I mean majority of the people I say are Africans. If you take an African family now, the person that's going to have the biggest carbohydrate intake is the father. That's how it is, and the father is going to have more meat. Even though the father at that point does not need a lot of protein, the children and his children going to have like small chunks of meat. So we need to start this wide sensitization that people need to know that there's something called portioning, and your portioning actually affects a huge part of what you eat.
Yeah.
Alcohol intake and smoking, and also I think that's going to be a big one. People need to cut down the alcohol intake, even though I didn't mention there are some cancers also that are also related to all of this. So if people can break down the alcohol intake, the cigarette smoking, we need to have campaigns, just like we're talking about anti-smoking, we also have pro-smoking campaigns, because a lot of these companies also, have to promote their products using influencers. So we also need to have more conversation around that. We should also advocate for exercise. People need to exercise 30 minutes of break walking 5 times in a week. I mean, that's good. At least getting 150 minutes every week. People need to know that they need to ambulate. We need to reduce this whole sedentary lifestyle, which is like a big one. I mean, contributing to this. We've talked about part of the diet is, I'm sure that salt intake also will be addressed. And I think a big one is for many third world countries also, we need to involve the government, because we cannot win this if we don't have health insurance or public-private partnership that can allow people to have access to health care. Because a lot of time, many of these diseases are silent. Many people don't know because they've not gone for testing, they've not checked their blood pressure before, they've not had lipid checks, not checked their blood sugar, and it goes on and on. And then we're going to have things like diabetes, hypertension, all of that silent. Until then, they have a heart attack or a stroke when they come to a hospital. So if we involve the government, and the government needs to understand this, that we need to subsidize healthcare. Well, I don't really know what it is like, in the UK and US. I mean, when it comes to like healthcare, but I'm talking about Africa, using Nigeria as an example. A lot of people pay out of pocket. A lot of people don't have health insurance. So many of them, because they cannot afford healthcare, what do? They go to the traditional herbalist. They go to get drugs that are very dangerous and actually worsen. And that's why if you look at our health indicators, we have like higher with this. We're having increasing morbidity and mortality. So I think we also need to work with the government. All right.
So what I'm gonna just kind of unpick in terms of, I guess you asked about kind of experience in the UK, but also I'm gonna just pick apart your point about diet as well, because I found that really interesting. Because there might have been a way, we're talking about the amount of carbohydrates and stuff, which maybe at a time when people were more active, that might have been a thing. Whereas now, obviously, if you're not active, if you're having the same amount of calories and carbohydrates, that wouldn't really, that will lead to all these other diseases. And then on your second point as well, I think what I want to mention is that representation is really important. So I know, I guess with you in particular, you're surrounded by Africans, so people will see their doctor that looks like them all the time. So it's easier for you and your patients to kind of listen to you and kind of have that experience. But if we're thinking more, I guess, even looking at outside Africa and looking at other countries like the UK, very few people that look like us, are kind of sharing these messages about health, and telling people about health problems. So that can also have an impact on access. An example being, if you have a black doctor or a doctor that looks like you saying that, look, I understand these are the issues that face our community, but, stuff like prostate cancer. So I'll give you an example. When it comes to, prostate cancer, as black men, we are more than kind of twice as likely to get prostate cancer. 1 in 4 black men will get prostate cancer compared to 1 in 8 from other races. And there is multifactorial. One of them is because Black men can have delayed presentations. One of the impacts and the really important work that's being done in Hill is that sharing this information means that people that look like us, they can relate with that more, and that message is even more powerful. And I say it kind of goes across kind of different things. So that is the impact of what we're doing now. When we link to diseases like prostate cancer, which is it's one of the kind of common things that affects us. And even what we mentioned about kind of diet and even smoking and things like that. So this is like I said, there's multiple factors here. I also want to touch on mental health as well, because that is something that really, that impacts everyone, as well. But we also have unique challenges, as Black men when it comes to mental health, with some of the things that we will have to deal with. And this is also adds into what the point I was making, that having more advocates, so having people kind of advocating, saying that if you are worried about these factors, you're worried about your mental health, please come and speak to someone. I think there's a real power in all of that, really.
Yes, yes, definitely. I agree with you. And I think we need to actually even talk more about mental health because it's an area that people really shy from because there's a lot of
Yeah,
stigmatization around mental health.
yeah,
And people don't understand it. A lot of people that are religious would want to pin it all down to religion, spirituality, and all of that. So I think it's very, very good to also talk about mental health. And well, with the use of the media, I think there's been increasing awareness around mental health. And one thing is for us Black people, issues that have to from mood disorders, depression, anxiety, eating disorders, and all of that. I think they are a big one. And suicide. So if you use social media, for example, I was reading the news today, and a prominent person that owns one of these, or top CEO one of this fintech company, I think committed suicide just today. I
really.
mean, yeah,
Oh, wow.
today. Yeah,
Gosh.
so it's all over the news, and I was just reading that. So, and I think it's the time is now for us to talk about
Yeah.
how do people protect their mental health? How do they get connected to healthcare services that provide mental health support?
Yeah, it's about maintaining your mental health, isn't it? And I think it's interesting when you can see that everything is linked. So we've talked about some of the factors, like diet, exercise, some of the unhealthy habits like smoking. And when it comes to mental health in particular, some of the things that you can do that can improve your mental health. We know that exercising, releases those endorphins. It also gets you to a stage, and I'm not saying, go and lift 100 pounds weights or whatever. This is like, you can go for a walk. It's whatever is suitable for you. But so there are certain things that you can do, I guess, that can keep you, I guess it's going to prevent things. But it's just about speaking to people. If you're struggling, kind of really listen to yourself. There is completely no shame if you are feeling down or you're struggling. There is no shame in really opening up and speaking to someone that cares, because the people around you that care about you just want the best for you. So I think that is the main thing, and you're completely right about the stigma that is within our communities when it does come to these kind of issues. And so, harking back to what you said, with stigma, the way in which we can break that down is by literally just spreading that information. And as doctors, you can say, we've seen so many things. I'm sure you've seen loads of patients that struggle with their mental health. The point you made about a fintech founder, as well. So there's so many things that we've seen, and if people feel more comfortable, and less stigmatized in sharing these difficulties, I really do think that that's a way in which we can, as a society, kind of improve this aspect, really.
Yeah, I totally agree with you. I totally agree with you because if more people understand how mental health presents, especially in the early phases, people will be able to know that, okay, I think I need to see a doctor, I need to see a psychiatrist, I need to have a therapy and all of that. So,
Mhm.
but the thing is, when people don't know, they look for alternatives to cope with all of this. And at the end of the day, many people might, just keep dipping lower, 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 lower until that. So I think, yeah, it's a good one.
Yeah. And I think it's all about, we always say kind of prevention is better than cure. I'm the type of doctor
Yeah.
that I always tell my patients that, whatever you do is going to be a lot more impactful than any tablet or whatever that I can give you. So the point about that is that if you're able to really kind of look within you and see what you can do in certain situations, how your family or your friends can support you, then that would you put things in place, and that should help you to move forward. And I think we talked about kind of preventive healthcare. It's probably a good chance to have a discussion about kind of screening and kind of screening for kind of some of the common conditions that can affect Black men in particular. So I don't know your experience, but it'll be good to kind of hear a bit more about kind of screening and seeing how we can improve uptake of screening tests and as what kind of things that Black men should be screened for, really.
Okay. Well, thank you very much for that. Well, I think just like we said earlier on, there are some conditions that we Black people will have a higher risk of having. I mean, compared to other populations, based on their genetics, and it would be good as we Black people, we get screening and get aware of them. Okay, so I just list them in no order. Just I think we can just dial. I think the first one I would like to talk about is prostate cancer, which you mentioned, and I think it's good I coincidentally I made a post about prostate cancer on Twitter today, and a lot of people were shocked that do I need to? I mean, I'm not yet old. I'm just in my 40s. I said no, 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 no. That's the big reason you should. Then I
Yeah.
was then telling them about digital rectal examination piece, and all everybody was like, "No, I don't want." I said, "No, it's not as it
Is
looks." You
the
understand?
risk exactly twice as likely to get prostate cancer. So it is really, I'm really glad that you're sharing that information because it's so important, isn't it?
Yes, very, very,
Yeah.
very important.
Yeah.
Yes. So another thing, another one, well, is even though we don't really do it occasionally, but I think colorectal cancer is a big one too. And I think the light shone on colorectal cancer when we lost in may so rest in perfect peace Chadwick Boseman. The
Yeah.
whole Black community we started talking about. There was a lot of discourse around colorectal cancer. I mean, that's the guy, the man that played the Black Panther. He succumbed. He had complications from colorectal cancer, and yeah. So just moving away from cancer, some other diseases too. So I feel that other things we can actually screen for is people need to actually go for routine medical testing. So I usually will advise. I mean, part of that is. Baseline, get your ECGs, your lipid profiles, your test your electrolyte and all of that to just see your kidney functioning. Well, glucose check also HbA1c is not a bad idea. And the thing is that I think a lot of people don't, and all of this, to translate to, it helps it helps to pick modifiable, non-modifiable, so that you can know the one you can actually address to have a lower risk of things like cardiovascular effects. So I think if we have more Black people going for all of these baseline tests, I think that's another one because many of these, I just mentioned, are linked to colorectal. I'm sorry, are linked to a lot of these non-communicable diseases. And then also, I think women, which also have to talk about self-breast examination and getting mammograms. So very, very, very important. We also have to advocate because we know breast cancer also is a big one in Black women. So we need to also make emphasis on self-breast examination and self-breast examination and getting mammogram. So just to say a little bit about PSA, prostate-specific antigen, it's just a blood test that the PSA, it's a chemical produced by the prostate, and usually when the person maybe gets their digital rectal examination, which people also like to run away from, doctor has to gently, after applying lubricant, put the hand in the through the anus. I think people don't like people don't like that part. And but just say about PSA. So when the doctor does the rectal examination, we then move to the PSA, which is like a blood screening. We have values that say, oh, it's suggestive and all of that. And usually when people have a family history, it's advised to actually, get it very, very much done.
Yeah, I
Well,
always say with the
okay.
PSA test, I always just tell my black male patients because the risk is double really. 1 in 4 black men will get prostate cancer. Because of that risk, we currently say if you're over 45 and a black male, then we'd suggest having, PSA blood test. And like you've touched upon, that is a blood test. The PSA is this it's a protein that's released by the prostate. So you can imagine if there's something like a cancer or any inflammation in the prostate, its levels will rise. So that allows us to kind of see and you really jump on it. But certainly if you're over 45 and a black male, it's worth speaking to your doctor. It's a really good kind of prostate society questionnaire. And if you feel that you want to speak to a doctor, but you might feel it might be difficult, or maybe if you feel embarrassed or struggling, there's literally like a sheet. And I think hopefully they'll put it on here somewhere. It's a sheet, it's 1 page, you can print it off. It's got any questions, all the concerns, and you can hand that to your healthcare professional. So these are all ways in which you just get the help that you need. So it's exactly right. So screening prostate with PSA, that's important. And obviously with bowel cancer, the way in which we screen for that will be a stool test. And it's basically
Yeah.
it's just like a stool sample that is sent, and basically that looks for any hidden blood in your poo. So sometimes you might have a blood that you might not actually see with your own eyes, which is why it's really important to get those kind of tests. It's kind of age related. So in the UK, kind of depending on the age, basically 60 to 74 years old, then you might be invited for the bowel cancer screening, which are these poo samples. I also want to touch on symptoms of bowel cancer as well, because that's obviously quite important in particular. So, if you do notice that you're having, blood coming from your poo, it's really important to see someone to be further investigated. Obviously, unexplained weight loss, if you had a loss of appetite with no explanation, then that really needs to be further investigated to rule out anything of that sort, really. And obviously your doctor, if you go for a routine blood test, if you've got persistent anemia, which anemia is basically if your blood count is low and we don't know why it is, then your doctor might arrange some further tests as well, to look a little bit more into it and just figure out what's, if there is something going on. So there's a few things to look out for. But like we said before, prevention is really important. So what falls into prevention is, the stuff that you can do to reduce your overall risk. So we talked about kind of smoking, alcohol, diet, keeping active, but then also part prevention is really kind of attending or having you in the screening, because that also helps. Even if that something was found, at least it will be found early enough. So any actions or any treatment could be successful, because this is something, yeah, like I said, this is something that can impact our outcomes. And basically, if people are not presenting early enough, that just means that treatment unfortunately won't be as effective. And that's something I do find a bit sad. So when the researchers looked into, so when black men are diagnosed with prostate cancer, the research has unfortunately found that it's more likely to be aggressive, and less responsive to treatment. And so it all links basically, because we just present later, which is unfortunate.
Yes, definitely. And I was just going to say something that I think women also, we need to also normalize testicular examination, because it's something that people don't really do. So just like a lot of time we're always talking about self-examination, we also need us we black men to talk to also adopt, examine our testicles once in a while when you're bathing. Just take a look at it, examine for lumps, examine anything. You understand? Because even though not very, very common, testicular cancer also is also a thing. But I think with self-testicular examination, if more people can examine their testicles, it's a great one.
Great point you've made, and I think two points on that. Even it's examining yourself after a bath, or like a shower. That's a really good point, because what happens there is that it just makes it easier for you to feel any abnormalities when you've had like a warm bath or like a shower. And also the second point you made about kind of examine yourself often. So we will suggest that you'd examine yourself at least once a month. Now that just helps you to know what is normal for yourself. So you know what things are like. So basically, the month that you feel a lump that is not normal for you, straight away that month you go and see your doctor. And if there was an issue, that gets treated straight away. I'm really glad that you've made that point. You've made that point there. Really, and I think we talked about quite a lot of quite a lot of things. And I've really enjoyed our discussion today. But I think
I
it'll be good
also.
to, yeah, yeah, it's been really good actually, and it'll be good to see if I don't know if anyone's got any questions for us or specific things. It'd be really good to kind of engage with the audience and see if we can touch on some points as well. So I'm just going to see if there's anything in the chat. There's a question here so it says are you aware of Dr. Sebi and Dr. Leila Africa works? If can you just expand on what in terms of some of the works and anything that you'd like us to touch upon, um if that's okay. You can just type into the chat box. All right, okay. So there's a question here that's asking about erectile dysfunction. It's also a common condition that can affect men, obviously kind of black men as well as other men. So that's a really good one to discuss actually. Because like
Yeah.
a lot of stuff, um, people might feel embarrassed about it, but I always just tell my patients that look, if it's having an impact on you, because it does, it can have an impact on your relationships, your self-esteem, go and see your doctor because there are multiple things that can cause erectile dysfunction. So I guess so just tell me a bit more about like in your experience, what kind of things have you seen that could be causing erectile dysfunction?
Okay. Thank you very much for that. So I think the first is the psychological.
Definitely, yeah.
A huge part of because I usually tell people and my patients that a huge part of sex is actually psychological. It's not just the act. You also have a psychological aspect of that. So when you have people that have things like anxiety, they're stressed, or on some drugs, that affect their psyche or anything, all of that. So I think a huge one is psychological. Then we also have, so just to mention, is that when we say erectile dysfunction, it has to do with problems with one initiating and maintaining erection, because some people might be able to initiate erection, but they cannot sustain it, and some people the other way around. So another thing, another factor, big risk factor apart from psychological, is conditions like diabetes. We know diabetes is able at the microvascular level is able to destroy some of the nerve supply to the penis, and that can actually affect how erection occurs. Alcohol intake and some of these recreational drugs also. I don't know why alcohol and smoking they always come up every time you're talking about risk factor, alcohol and smoking. So I
Yeah,
think
but
it's a
that's
good
good.
worthy mention that cutting down alcohol and smoking.
It's good though because it's a
It's
theme, isn't it? From our discussions, we've been talking
exactly
for an hour, and there's a theme here, and it's good
yeah.
because I guess people watching can straight away see that there are a few things. There's very few things that cause everything across
Yes.
different conditions. So it makes it more important if you can reduce it. You can see, we're talking about cancers, we're talking about mental health, we're talking about now about erectile dysfunction, and it's the same things that are coming up, isn't it?
Yes.
Yeah.
Yes. Okay, then also high blood pressure and high level of fat or hyperlipidemia also can also impact because when we have fat, just like the way the fat can block other vessels in part of the body, it can also do that in other fat and lead to problems with erection. And also some heart diseases. So people that have had heart disease also, it's not unusual to find them having erectile dysfunction and some drugs. And that's why it's always good that when we as healthcare providers are actually giving our patient medication, we need to counsel them if it's a drug that can affect their erection, because we know there are some drugs, some antihypertensives, some drugs that can actually affect people's erection. So it comes as a shock to them. Obesity also, obesity, as there are increasing evidences that obesity also is it's linked to erectile dysfunction. Some post manifestation of some disease conditions, anything that affects the hormonal profile too. So when we have conditions that either at the level of the brain or at the level of the testicles that we don't have enough testosterone being produced. Also, we know testosterone is involved in all of our sexual prowess, our sexual functioning, so that can cause problems. And when we have brain tumors, things like that produce high prolactin, and or for some reasons where maybe some people have with conditions where they don't produce enough FSH or LH. We know that also will cause
Yeah.
low testosterone, which can then manifest then as this. And well, in some people, and I think once we are able to find the causes, and there are because erectile dysfunction, we know the management apart from trying to establish the underlying cause which you want to correct, there's also a lot of lifestyle and dietary changes that you also need to counsel people on, because and also some people also might need to even have psychological therapy. And I think if all of these are married together, then plus or minus the meds, a lot of people usually should do well. But one thing is very important is that men are very, very shy to talk about it, because
Yeah.
when you cannot perform in bed, it's like, am I weak? Am I this? People don't want to
It
be
can have an
vocal about it.
impact
But
on your
yes,
self-esteem,
exactly.
your view on yourself. And an important decision. I always kind of speak to my patients because you're completely right. There's like basically two main courses that you've got. You've obviously got the
Mhm.
psychological stuff, and then you've got what we call like the physiological, so the kind of physical stuff, basically. And there's so many courses that you've gone through. And with those two different types, you can have different symptoms as well. So particularly if it's like a psychological thing, you might not be able to kind of perform or struggle to maintain erection during sexual intercourse, but these people, you tend to still have kind of morning erections, and you can have kind of self-stimulated erections. So basically a lot of psychological anxiety and stuff like that, there is still some kind of function. Whereas if it's a condition, like advanced diabetes or, like a medication, then usually with that, you will struggle to have an erection, in kind of throughout in different circumstances. So the whole point, because we've talked about how things link together, we know that, if you are suffering in silence and if you are having erectile dysfunction, not, and you feel embarrassed to see someone, we know that that could be linked to your mental health. It can affect your self-esteem and things like that. And it goes back to what we talked about. Like it's so important to see someone because these things can snowball. And as doctors, like we see this often, especially as male doctors, like at least once a day. It's stuff that we see. So we are just your advocates. So we just want to make sure that we take this seriously because we know that it can impact other things. So if there are things we can do, I've had a patient who was on certain medications that we had to alter the doses and he was completely fine. Patients who, had really poorly controlled diabetes and that caused it, which we were able to kind of rectify. So it's just basically because there's so many solutions, because there are so many things that can cause it. I think exactly that. Come to see a doctor and not feeling embarrassed and doing that. There's always going to be a solution there, and taking it from there really. So I think we talked about erectile dysfunction, and then I think there's a point here. Someone's asking a question about infertility in Black men. So it'll be useful to kind of touch upon that. I don't know if you've seen many kind of cases of infertility in Black men, and yeah.
Oh yes. Infertility too is another very important one too, because just like sexual prowess, when a man is married and when they decide to have a child and they're not having a child, it can also impact on the the psyche of the man, and
Exactly.
something we know a lot. The thing is that a lot of the conditions that we even mentioned earlier can actually cause infertility also. And just to other add is some infections. So when we have infections that affect the quality of the sperm, so some of that. And in this case, I would also like to add diseases like chlamydia and gonorrhea, which can also cause infertility because they can they can damage some part of the male reproductive system. Alcohol and smoking still goes for
Yeah.
infertility.
I love how you bringing that in because it's everywhere. I love
Yeah,
you
it's
bringing
like
it, getting the
it's like
message.
it's like everywhere. So and the
Yeah.
thing is that so I think basically those are similar because the hormonal ones I mentioned also they also affect infertility too when we do because these hormones also control sperm production and if it's not adequate the man might not have
Yeah.
adequate sperm production. So I still think a
Yeah.
lot of the causes of the erectile dysfunction still can also cause infertility. Just now, I'm
Yeah.
adding the STD like chlamydia, gonorrhea also.
And in infertility, it might be helpful to break it down because I guess when we mention infertility, it just means that the actual sperm, the semen, is not functioning. And what I suggest there's kind of three main ways that I break it down. So if I'm going to explain to someone kind of infertility, first you could have a lack of sperm. So if you've got a low sperm count, or no sperm at all, that can cause it basically. Secondly, the sperm might just not be moving properly. So this might be just kind of erratic movements, or also the sperm might be moving really too slowly. So when that happens, it might make it harder for the sperm to actually swim towards the egg. And then the third way that we can define infertility, so there's different ways, and the sperm might just be abnormal. So the shape sometimes might be a way in which it makes it harder for it to actually move and to fertilize the egg. So these are kind of all different ways in which infertility can actually present. And exactly like you said, there's multiple factors, there's multiple things that can cause it as well. And even kind of talking about, we talk about kind of testicular cancer and other testicular disorders. Obviously, that's where the sperm being stored. So issues from that perspective can lead to infertility as well. And also even I think people in terms of when you talk about kind of infertility is most couples about 86% of couples will kind of conceive naturally within the first year with regular sexual intercourse. So sometimes people might be maybe trying for a child in a couple of months, and can I say infertility, but that's not kind of necessarily the case as well. To have that label put on. So I thought I'd just mention that because um you know that's not always the case. Yeah.
Yeah, yeah. I think I totally agree with you. I was just going to chip in another thing. I know I didn't mention it, varicocele,
Yeah.
which is though it's that's like common. You mentioned the tumor. I just thought to chip in varicocele, which is well, the urologist will see that more, but just to say it happens when we have dilation of some of the veins in the scrotal area, and that can also affect the whole balance and can affect sperm production, and also it's a big cause of infertility. I just thought to add that. Thank you.
Yeah. Yeah. I think
Well, on the descended test is also well. I didn't mention that. Maybe I didn't want to make it so very very intense medical. So cryptorchidism, like for people that maybe they have undefended testis also, that also can be a cause. Yeah, thank you.
yeah. Yeah. And yeah, I think it might be helpful. I think we talked a bit about mental health, and you've made a point earlier on as well. So just kind of going back, so we've talked a bit about infertility. I think we've answered that question. Someone's put a question down about kind of mental health and in particular addictions. And I know you mentioned really at the start about kind of alcohol intake and how access to really kind of cheap alcohol can. So it would be just tell me a bit more about, I guess, touching on that the question about addictions and
Okay. Well, addiction. So addiction has to how do I explain it? I think it's also a very huge one we should talk about with the advent of things like drug use, alcohol use, and I think addiction is actually bigger than that. Gambling also, now that we have a lot of all of this football and sport betting app, and I think addiction has a huge spectrum. So it just has to do with this uncontrolled compulsion to like do things. We can have people that have pornographic addiction, so it's on and on. But I think the approach to addiction is people need to understand that addiction is not something you just say you want to stop. I usually advise if you want to stop addiction, because a lot of people, for example, when they listen to programs like this or Google the internet, they find that, oh, I think I might be addicted to this. And before you even say you're addicted to something, there is like a criteria, because usually the whatever you are addicted to, it's like it's taking a lot of place and actually affecting your day-to-day activities. Actually, we advise people to see professionals. So we have like I mentioned, that we're having more awareness, and a lot of people are talking more about things that have to do with mental health. And so we know that people can see psychologists, psychiatrists, and well, I'm not a psychiatrist, I'm a psychologist, but they are able to know what kind of therapy, whether they want to do CBT, how to help them, how to help people to battle addiction. But I think it's good we're talking about addiction, because addiction, if it's not addressed, young people have been known to overdose on drugs, overdose on alcohol, engage in very risky practices. For example, drug addiction, IV drug abuser. We know that they can have increased risk of diseases, hepatitis B, HIV, infective endocarditis, for all of that from experimenting. And so I think people need to know that there is treatment. You can actually reach out to professionals that can help you. You don't have to bottle all of that within you. But if people feel they're addicted to something, they should actually seek for help. So I don't know what's your own take. What do you think?
Yeah. I like the point you made about kind of CBT as well. So basically CBT is kind of cognitive behavioral therapy, and all it does is basically, so I usually like draw a triangle for my patients, and basically you got your thoughts, feelings, and behaviors. And what CBT does is that it helps you to form a link and understand how your thoughts can impact on your feelings, which can then impact on your behaviors. So the point you made earlier on is that, sometimes you might have underlying conditions like, depression, anxiety, and things that, can escalate and then cause certain addictive behaviors using illicit drugs, which have the circumstances. So something like CBT can be really effective actually in breaking that cycle, because it basically just gives you the toolkit. It gets you to realize that, oh, okay, I'm having this thought and it's giving me this feeling, and it results in this behavior. So how do I break that cycle? So the reason why I'm explaining it in this way is that it means that if you understand how the treatment works or how CBT works, then this means that you're more likely to actually go and find that help and seek that help and speak to your doctor and your mental health professional, because you can see how that can get you out of a hole and then stop you from spiraling into other things like kind of illicit drug use, and things like other addictions as well.
Yeah, thank you for that.
Yeah. So I'm just looking at I'll see if you've got any more questions as well. So yeah, so someone's asking about kind of specific questions. So schizophrenia and bipolar affective disorder. So looking at schizophrenia in particular, we know that it's kind of, in terms of kind of prevalence, it is quite high in patients that use particularly cannabis. So very heavy kind of cannabis users, do kind of have an increased risk of schizophrenia. And that's what we see basically. And that's a condition that is basically the hallmark is kind of a lot of kind of paranoid delusions, and also kind of basically seeing things that aren't there or hearing things that aren't there, or feeling things that haven't happened as well.
Mm.
Yeah. So I think that looks like most of the questions are in the chat box, unless there's anything else that anyone's mentioned. It looks like we've answered all the questions in the world, Dr. Sina. It looks like we've
Okay.
it looks like we've solved the world's problems. There's no more, there's no more questions, which is good. Well, yeah, I think the reason why we do this is just to there's power in people seeing people that look like you, just explaining things and trying to really. I think the points that we made, it's a theme really, and I'm sure you kind of echo it. There's a theme basically: prevention, seeing through things really early, screening, and you can see all the risk factors are all linked. Which so if it was something that you were struggling with, so we're talking about alcohol intake and stuff. If there is something in particular you're struggling with, hopefully this gives you a bit of motivation because you can see how certain things like smoking not only affect your mental health, they can also increase your risk of certain cancers. It can also have impact on other conditions like erectile dysfunction, and so many more things as well. And hopefully we'd be able to put a link somewhere in the notes. Basically, there's loads of kind of support services, to help you if you are struggling with anything in particular.
Mm.
Yeah. And I guess so we just had just one question come up on the chat box about just so we've not
Okay, I
touched
don't
on.
think there are other questions.
Yeah. Is this something about BPH, benign prostatic hyperplasia? So so yeah, I'll just touch on that really quickly actually because it's just literally just last minute question there. I mean so basically BPH, that's just short for a condition known as benign prostatic hyperplasia. And all it means, so basically your prostate is a walnut shaped organ that sits just below your bladder. And basically it surrounds the tube through which your urine comes out of, basically. So we call this tube the urethra. And what happens is that as you get older, your prostate can enlarge. So you can imagine like something that's going around the tube through which your urine goes out of. If it gets larger, it can push on that tube. And so a lot of patients sometimes have symptoms that affect their water work. So an enlarged prostate, that's not cancer. This is the most important thing, is a common condition. But like I said, if it's enlarged, it can cause problems. So a lot of common problems could be maybe waking up at nighttime, loads of times to wee. You might also find that when you have a wee, is a very poor stream. So it means that it's not a strong stream, it's stop and start, or you don't completely finish. And sometimes you might find that when you feel like you finished, there's still a bit more wee to come as well. So those are some of the symptoms that you can get with an enlarged prostate. And the way basically that we do, your doctor can diagnose that with an examination, basically examining the prostate and seeing that it's enlarged. But there's loads of options to treat this condition. Firstly, obviously, a doctor will need to just make sure that things are okay with examination and a blood test for the PSA, just to make sure that there's no kind of concerns about cancer. And then following that, there's options to actually have medications that will actually work in a few ways. So there's a medication that can improve the flow of urine. There's also medications that can actually shrink the prostate as well. So there's lots of different options and things like that. So that's all kind of involved in this condition. So
Yes,
yeah,
thank you very much for that.
yeah. No, so I think that's most of the questions now. So are there any kind of, I guess, closing remarks that you have for our audience today?
Okay, so first I have to say a big thank you to everyone that joined this because I'm sure you agree that it's been awesome, and this is just the beginning of more series. So make
Yeah,
sure you subscribe so you're not going to
exactly.
miss more. So just to give an overview, today we've spoken about cardiovascular diseases that affect men. We've also talked about prostate health. We talked about BPH. We talked about cancers. We also talked about screening. We spoke about getting your PSA, your stool blood testing. We also talked about mental health and how to manage that. We also talked about erectile dysfunction. And so just to
Loads of
say
stuff.
that men we need not to be shy about all of this, and because there are there's help available, and you seeking for help does not make you weak. No, it's you just need to break off this old um, societal stereotype that we men need to bottle everything, and we need to actually know that we can actually get help. And some things we also need to do. We need to adopt a healthier lifestyle,
Mhm.
better diet, like we said. We need to cut down our alcohol and smoking if possible. Stop
Yep.
smoking.
I love the message. Keep it going. They'll listen to you. That's a great,
we
yeah.
also need to manage stress very well, because as long as you're alive, you're going to have some forms of stress, but you need to know how to manage stress in a healthy way. Good sleep, very, very important. Very, very important. Also, exercise, also very important. We also mentioned routine screening. It's also very, very important, because a lot of these things, they can be picked in early phases, and a lot of things can be done. And I'm sure that if we all can adopt this as black men, and we tell a black man to tell another black man to tell another black man, the world will be a better place. And like I said
Yep.
earlier, make sure you subscribe, because we're going to have more of these sessions, and it's something that is going to be bigger than this. So make sure you subscribe. I think the YouTube link, I'm not sure if you can see it, but if you can just click the subscribe button, just as a way of supporting, and we're going to have more of this. Well, I'm seeing people asking for our social media, and also how do we
Yeah.
how
Yeah, I mean, yeah,
yeah.
for me, so I'm on Instagram. Predominantly I'm on YouTube. So you can find me on Adumed, Adumed. So if you search me on Instagram, yeah, that'll be good. And then I've got my YouTube channel, same name, Adumed. My YouTube channel, it just basically shares kind of information to help patients make better decisions about their health. That's the main focus. I've got a lot of videos around Black men's health as well, and other conditions. And yeah, it's powerful stuff. My videos have been able to help. My practice population is being able to kind of help loads of people. So yeah, you can kind of find me on those handles across different social medias. But it's been lovely. I just want to echo what you said. It's been really nice speaking to you today. And yeah, I just hope that we have kind of more and more of these where we're talking to you, seeing how we can kind of help and give back to our community.
Definitely.
And what's your socials? Do you want to say
Okay,
something?
well, I'm not active on YouTube yet, but
Need
look
to get on
into
it.
it. Well, I use more of Twitter, that's X. I'm more on X, and my handle is at the bearded Shino. Like that's my media name, my bearded Dr. Shino. So it's just like at THE underscore then bearded and SINA. So you'll find me there. I host a lot of sessions, conversations, and I also make a lot of content that not just even men's health, that span various areas, and I also do collaborate, with other organizations that are vocal about things that have to do with Black people's health, to just give a voice to that. So, and we do have host sessions. I also have channels on Telegram. I also have a WhatsApp channel. I'm on TikTok also, but I'll definitely I'm going to be like Dr. Derek. I'm also going to try to get on YouTube sometime, and at least I've
Look
learned
forward
that
to
I need to get on YouTube. So yeah, but
it.
basically, I Twitter is where I do. I don't really use Instagram, but I do a lot of Twitter. X, sorry, X. That's the new name now. At the
Excellent.
bearded
Yeah.
Shino. Yes, but and in the name on the flyer, you can see the name. My handle is on the flyer. The flyer that was posted for this, so you can see my handle there. Thank you very much. You can follow me also if you have questions. My email is also there. You can always send me an email. I'll always be glad to engage you. And yeah, thank you.
Yeah. That's brilliant. Yeah, thank you so much. Yeah, I think that's everything. So it's been lovely spending the evening with you. I hope you all got something from it today. And yeah, until the next time. Thank you very much.